I'm Sarah Barnett, and I'm going to show you how to insert an NG tube today. I've gathered my materials. I've checked my doctor's orders. He'd like it set to low suction once it's inserted. I've come into the room, introduced myself to the patient, performed hand hygiene, and applied gloves. At this point, I'm going to measure out about how much NG tubing is going to be going into the body, starting at the nose, wrap around the ear, and down to the lowest point of the sternum, the xiphoid process. I've taped it off, and I'm ready to test the patency of the nares. Seems to be the left one is going to be a good one to use. No occlusions. No occlusions in the mouth as well. At this point, I'm going to lube the end of my NG tube. Have them sit in a high Fowler's position with their head back, and start insertion. Meeting a little resistance at the back of the throat. I'm going to check to make sure there's no coiling. I don't see that there's any coiling, so at this point I'll have them lean their head forward, and they can take sips of water as we advance the tubing down. And they're taking sips of water and swallowing until theoretically it would reach approximately where I've placed my tape. At this point, I need to secure the tubing to the face while I assess further. What I'm going to do, go ahead and tape's not cooperating, but I'm going to draw up about 15 milliliters of the contents. I'm going to test it on my pH test strip here. It's below a 4, so it's acidic. It seems to be placed in the right spot, but my next step is to take my stomach contents, listen in the left epigastric area, and I'll be assessing for a swooshing sound. Positive swooshing sound, that means that my tube is placed correctly into the stomach. At this point, I would hook up the tubing to low intermittent suction, and I need to secure the tubing to the face and the bridge of the nose. I've split my tape here to create an anchor. Up and over, up and over. I'm going to ask my patient if they're comfortable, if they're having any problems breathing or swallowing for any reason. Everything seems to be fine. I will advise them that they need to keep their bed above 30 degrees. And then if they're having any complications, to give me a call. At this point, I would clean up my area, I would remove my gloves, perform hand hygiene, and document that I have placed an NG tube. And I would also document the pH that was tested. After some time, the NG tubing may become blocked or occluded in some way, so there needs to be a way that we can test this and flush it out. So I would enter the room, assess my patient, make sure everything looks okay. I would turn off the suction, remove the tubing, and at this point I could draw up 30 milliliters of regular water. It can be tap water, it can be sterile water. It's not really an issue. Introduce the 30 into the line and pull back. In the event that I don't get 30 back out, an equal amount that I put in, I will just continue to pull 30 and push 30 until I get out equal amounts. Once the line is cleared, I can hook it back up to suction, clean up my area, remove my gloves, perform hand hygiene, and document in the record. Professor Sink, I realize that the only issue I have with this video is that I'm not wearing my FSCJ blue polo, and for that I apologize.